Welcome to another one of my podiatric injection videos. Now, this lovely lady is a colleague of mine who has suffered a tri-malleolar ankle fracture along with a Lisfranc fracture dislocation. Surgery and the length of time she has spent in a boot have left her with a very stiff and painful beginnings of osteoarthritic ankle joint, and she has been limping around clinic since she had her fracture boot off for some number of months. We have discussed this, and we decided to perform injection therapy after she's had multiple surgical procedures. This injection is a combination of corticosteroid and hyaluronic acid. We're taking a lateral approach to her ankle mortise. And this was done under ultrasound guidance. Now, one issue we had here was, although we had a perfect needle placement, the scar tissue of the ankle joint is such that our 1-inch needle was not long enough to cleanly access the joint capsule. And what I've done in this case is actually ended up having to change the needle for a much longer needle. We have anaesthetized the soft tissue with the local anesthetic loaded into the connecting tube here. As we can see, the corticosteroid, the white solution, is still within the tube. I'm trying to reposition the needle to try and enable us to get into the joint capsule. This actually doesn't work, and you can see the pressure of the syringe just not allowing me to proceed with the injection. I don't like changing needles. I've gone here for a very long green 21 gauge needle. Fortunately, the patient at this point was sufficiently anaesthetized. This was not a painful second injection. This does give us much a deeper approach into the joint. And here I'm ensuring there's no air bubbles and re-guiding the needle with ultrasound for an accurate placement. As we can see, once I've replaced the needle, the injection goes smoothly after this. As I said, we have the corticosteroid preloaded in the tube. The next is the hyaluronic acid. I like to use 40 milligrams for this, and so 2 20 milligram syringes are administered. You can see this is going much more smoothly now. And remember also to flush the syringe, which has just over 1 ml of fluid, using the last of the local anesthetic to do this. Once you feel the syringe give, you know your injection is complete.